Good day, everyone. My name is Christina Marie Reina. I'm a student nurse from Southwestern University of Finma. And for today's video, I am going to perform a return demonstration on the assessment of thorax and lungs. So prior to performing these procedures, you have to gather all the equipment that you will be needing, such as centimeter ruler for exact measurement, washable marker to mark and pinpoint locations in this assessment, examination gloves or clean gloves to protect ourselves from the patient, alcohol solution to sanitize ourselves, and stethoscope for better hearing of the sounds. You also have to perform proper hand hygiene to reduce transmission of microorganisms. Good morning, ma'am. I am Christina Marie Reina, your student nurse for today, and I am going to assess your thorax and lungs. Is that okay with you?
Okay.
So before we get started, since you don't have an armband with you, can you please verify your full name and date of birth for me?
I am Miss Rosemary Reyes. I was born on February 10, 1968.
Very good. So greeting yourself and identifying your patient is an important step to know if you're handling the right and correct patient, thus ensuring patient safety. Okay, so what would you like me to call you po?
You can call me Miss Rose.
Okay, so Miss Rose, I am going to do an assessment on your thorax and lungs, and in order for me to do that, I'll be exposing some parts of your body and touch your skin, especially your upper extremities, including your back, and do some marking as well. So is that okay with you?
Okay.
Okay, good. So I've given you a patient gown so that I can only expose the area where I'll be doing my assessment, and for your privacy, I already closed the door. So don't you worry, Miss Rose, the findings that I will gather in this assessment will remain confidential between you and me, and also the healthcare facilities as well. So before we begin, do you have any concerns or questions with regards to the procedure?
No.
None? Okay, good. Okay, so first, I will assist the patient in a comfortable position so that she can remain relaxed all throughout the procedure. Okay, so can relax now. Okay. And then I will inspect first the face, the mouth, the nails, and the chest of the patient. Okay, so Miss Rose, kindly remove your glasses from me.
Okay.
And then kindly look up your eye as I pull down your lower eyelid, and look down as I pull up your upper eyelid. Okay?
Okay.
Kindly look up for me. Okay? Kindly look down. Okay, good. No signs of swelling in your conjunctiva, which is a normal finding. Next, can you open your mouth widely for me? Okay, good. No signs of any bumps, masses, or lumps, and swelling as well, which is a normal finding. So can you please lay out your hands for me like this? Okay. Okay, good. So upon palpation, the capillary refill time is less than 2 seconds, which is a normal finding. Okay, so Miss Rose, I am going to palpate your anterior chest. Is that okay with you? Okay. Okay, so upon inspection, the anterior view of your chest doubles the size on the lateral view of your chest, which is a normal finding. Okay, so now that I'm done inspecting, can you please face backward so that I can now assess your posterior thorax? Okay, so now I'll be inspecting for the skin, the bones and muscle of the spine, the shoulder blades and the back as well, and also the symmetry of the chest excursion and usage of any accessory muscles during respiration. Okay, so upon inspection, the shoulders are symmetrical as well as the scapula. I don't see any abnormalities in the position. No signs of skin conditions as well. The spinous process is aligned straight. I don't see any lateral or exaggerated curvature from your cervical, thoracic, and lumbar area. So this means that the patient is free from any signs of scoliosis. Also, I don't see any usage of any accessory muscles when breathing, so this is a normal finding. Okay, so now I'll proceed in palpating the skin of the patient to assess for the skin temperature. Okay, so Miss Rose, is it okay if I touch you? Okay. But first, I will just warm my hands and use the dorsal surface of my hands since this is the most sensitive to temperature. Okay, so upon palpation, the skin temperature is uniform, which is a normal finding. Next, I'll be palpating again the skin of the patient to assess for any signs of tenderness, lesions, masses, or any skin conditions. Okay, and this time I'll be using the palmar surface of my hands. Okay, so Miss Rose, do you feel any pain?
No.
Any discomfort?
No.
Okay, good. So upon palpation, no signs of tenderness or pain and no signs of lesions or masses as well. So this is a good and normal finding. So next, I'll be assessing the tactile primitus of the patient. And for this procedure, I'll be using the ulnar part of my hands and I will palpate it over the posterior thorax of the patient beginning at the lung apex. Okay, so Miss Rose, every time you feel my hands on your back, kindly say 99 for me.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, so upon palpation, vibratory tremors coming from your sound is felt and symmetrical, which is a normal finding. Okay, so now I'll be assessing the chest excursion of the patient. Okay, so I'll be placing my thumbs along the spinal processes of the patient at the 10th rib with my palms contacting the posterior lateral surfaces. Okay, so Miss Rose, kindly breathe in and breathe out as I say so. Okay, breathe in, breathe out, breathe in, breathe out. Again, breathe in, breathe out. Okay, good. So upon palpation, the chest excursion is symmetrical. As the patient inhales, there's a separation of 4 centimeters of my thumbs, which is a normal and good finding. Okay, so next I'll be percussing the posterior lateral lung fields of the patient to assess for the tone. So I'll be using my index and middle finger to percuss the posterior lateral surfaces, and with my non-dominant hand, I will hyperextend it and make contact with and with my middle finger, I will make it contact with the posterior lateral surfaces. Good. Okay, so upon percussion, there's a presence of low-pitched resonant sounds in the lung fields, and also slight dullness of sounds are also heard, which is a normal finding since there are areas that are solid and fluid filled. Now I'll proceed in percussing again the posterior thorax of the patient, and this time I'll be assessing for the diaphragmatic excursion. Okay, so Miss Rose, I'll be using a washable marker to do some markings on your posterior thorax. Is that okay with you? Okay, good. Okay. So kindly breathe in and breathe out for me and hold it as I say so.
Okay.
Inhale. exhale, inhale, exhale, hold. Okay, you can now breathe in. Okay, kindly do it again. Inhale, exhale, inhale, exhale, inhale, hold. Okay, you can now breathe out. Okay, good. So I will do the same thing on the other side. So kindly inhale again for me. Exhale, inhale, exhale, hold. Okay. You can now breathe in. Okay. Kindly inhale again for me. Exhale, inhale, exhale, inhale, hold. Okay, you can now breathe out, Miss Rose. Okay, so now that I'm done percussing the skin of the patient, I will now proceed in auscultating the lungs of the patient, and for this procedure, I'll be using a stethoscope. This is to assess for any lung sounds and any abnormalities. So Miss Rose, kindly inhale and exhale for me as I say so. So kindly breathe in using your nose and breathe out using your mouth. So every time you feel my stethoscope on your back, you can breathe in and breathe out. Okay. But first, I will just warm my stethoscope. Okay. Okay, good. So upon auscultation, I can hear your bronchovesicular and vesicular sounds, which is a normal finding. No signs of any adventitious breath sounds. Okay, so now I'll auscultate again the posterior thorax of the patient, and this time I'll be assessing the transmitted voice in her back. Okay, so Miss Rose, every time you feel my stethoscope in your back, kindly say 99 for me. Okay, okay.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so upon auscultation, I can hear spoken words that are muffled and indistinct, and there are no signs of bronchophony as well, so this is a normal finding. Okay, Ms. Rosned, this time, kindly say E for me every time you feel my stethoscope on your back.
E, 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 E.
Okay, so upon auscultation, I can hear muffled E, which is a normal finding. So if A is heard instead of E, then this indicates that the patient has egophony, so you have to take note of that. Okay, now one last time, Miss Rose, kindly whisper 99 for me every time you feel my stethoscope on your back. Okay, so upon auscultation, whispered words are muffled and indistinct, which is a normal finding. Okay, so now that I'm done assessing the posterior thorax of the patient, we will now proceed in assessing her anterior thorax. Okay. Okay. Okay, so Miss Rose, is it okay for you if I expose your anterior chest?
Okay.
Okay. Okay. I will assist you and may access on your anterior chest. Okay. Okay. Okay, so I'll be doing the same procedure as I did in her posterior thorax. First, I'll be inspecting the skin coloration of the patient, the bones and muscle of the spine, and also the symmetry of chest excursion and the usage of any accessory muscles during respiration. Okay. Okay, so upon inspection, there are no signs of any jaundice, which causes the yellowish tone in the skin. No signs of cyanosis as well, which causes a bluish tone in the skin. No signs of erythema as well, which causes a redness on the tone of the skin. No signs of lumps, bumps, or rashes. The shoulder blades are symmetrical. I don't see any abnormalities or deformities in her bones as well. And no usage of any accessory muscles when breathing as well, so this is a normal finding. Okay, so now I'll be palpating the anterior chest wall of the patient to assess for her chest excursion. So, Miss Rosemary, is it okay if I touch you?
Okay.
Okay. So kindly breathe in and breathe out for me as I say so. Breathe in. Breathe out. Breathe in. Breathe out. Okay, so upon palpation, the chest excursion is symmetrical. There's a separation of my thumbs, which indicates that there is a movement on the chest excursion of the patient. So this is a normal finding. Next, I'll be palpating again the anterior chest of the patient to assess for the tactile fremitus. Okay, so for this assessment, for this procedure, I'll be using my ulnar part of my hands and I'll be placing it on the anterior thorax of the patient next to the sternum at the second intercostal space. Okay, so Miss Rose, kindly say 99 for me every time you feel my hands.
99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, good. So upon palpation, there are presence of vibratory tremors, which is symmetrical as well. So this is a normal finding. Okay, so now that I'm done palpating and assessing the tactile fremitus and the chest excursion of the patient, I will do the same thing as I did in the posterior thorax and assessing the lung tone of the patient and auscultating the lung sounds of the patient. Okay, so assuming that I'm done performing these procedures, I will now proceed in assessing the breast and the axilla of the patient. But before we do that, I'll just ask a few questions with the patient. Okay. Okay, so Miss Rose, have you examined your breast lately?
Yes.
How often?
Once a week.
Do you feel any tenderness on your breast or your axilla?
No.
Any lumps?
No.
Okay, good. How about any discharges?
None.
None? Good. Okay. So now I'll proceed in inspecting the breast and the axilla of the patient, which is in two positions. And for the first one, we'll be assessing in the sitting position with her hands on the rest of on the side of her body, placed on hips and above her head. Okay, so Miss Rose, kindly rest your hands on your sides. Okay. I need to have an axis on your anterior chest. Is that okay with you?
Okay.
Okay. Okay. Okay, like that. Okay. Okay. Can you raise your hands above your head? Can you place it on your hips? Okay. Can you crouch like this? Okay, good. So upon inspection, the breasts are symmetrical in movement. No signs of any retractions or dimpling as well. So this is a normal finding. Okay, so now I'll be palpating the axilla of the patient. And this time, can they stand, Miss Rose? Can they sit down? Sit down. Okay, can you raise your right arm? This. Okay. I'll be touching your axilla. Is that okay with you? Okay. Do you feel any pain?
No.
Any discomfort? Okay, on the other side as well. How about here? Do you feel any pain?
No.
Not at all?
None at all.
Okay, good. So upon palpation, there are no signs of tenderness or pain and no signs of lumps or lesions as well. So this is a normal finding. Okay, so now I'll proceed in assisting the patient in a semi-fowler position, and we'll examine and inspect for the movements of her breast, any signs of lesions, bumps, or nodules. Okay, so Miss Rose, kindly here, kindly lie down. Okay, you can now lie down, Miss Rose. Okay, so now that the patient is in a semi-fowler position, I will continue to inspect the breast and axilla with your hands resting on the side, placed on hips and above her head. Okay? Okay, can you raise it above your head? Your hands, please, Miss Rose. Then you place it on your hips. Okay, good. So no signs of any retractions or dimpling as well. So this is a normal finding. So next, I'll proceed in palpating the breast and the nipples of the patient. So Ms. Rose, is it okay if I touch your breast?
Okay.
Okay. So I will use the palmar surface of my hands and palpate the nipple in a circular motion. Do you feel any pain?
No.
Okay, on the other side. Do you feel any tenderness?
No.
No? Good. So upon palpation, no signs of tenderness or lesions and nodules as well. The breast and the axilla are flesh colored, and the areola and the nipples are slightly dark in color. And the normal superficial patterns are also diffuse and symmetrical. No signs of any discharges as well, so this is a normal finding. Okay, so now that I'm done inspecting and assessing the posterior and anterior thorax as well as the breast and the axilla of the patient, I will assist her in replacing her patient gown. Okay, so Miss Rose, you can now sit up. Okay, so there's a bathroom there. You can change into back to your clothes, or you can replace your new patient cap. Okay. I will assist you.
Thank you.
And next, I'll perform hand hygiene again to reduce transmission of microorganisms. And I will record and document all findings that I've gathered in the procedure.